three topics will be acute prostatitis, chronic prostatitis, and what we call chronic pelvic pain syndrome. So let's just get rid of acute prostatitis from the beginning. And what that is, it's a bacterial infection in the prostate. Okay. It could be caused by the regular bacteria that we see in bladder infections that women have, for example, E. coli, or it could be from sexually transmitted diseases, like chlamydia and gonorrhea can cause an acute prostatitis. There's no mistaking those. I sometimes see patients coming from a clinic and they got a diagnosis of one versus the other, and they're way off. Acute prostatitis.
Sorry, is somebody going to have pain when they feel that?
Yeah, acute prostatitis, it is painful down below. It is painful when you pee. You have difficulty to pee. You have fever, you have chills, and you feel like shit. Okay?
So you have those symptoms. You're
sore, you're tired, you're in bed, you feel miserable. So it's not just a little bit of symptoms that come and go. We'll get to that. That's the more chronic prostatitis. But this is a real bacteria, like a strep throat, when you're sick and you feel like crap. That's what acute prostatitis is. And those patients, if you have any of these symptoms, go to the doctor now, because it can be spread through your body and you can get septic and be in the hospital needing intravenous antibiotics. So any of these lower urinary symptoms or bladder symptoms or pelvic symptoms with fever and chills and whatever, get it checked out today. Okay, that's acute prostatitis. Now, what's often mixed is what we call chronic prostatitis. So chronic prostatitis is the symptoms are more vague, and they're not, you don't good yesterday and today you're horrible. It slowly worsens over a day or a week or so. And the symptoms can be varied. You can have pain in the suprapubic area, just above the pelvic bone. You can have pain in the penis. You can have pain in the testicles. You can have pain underneath the testicles, which is called the perineum, the space between the testicles and the anus. And some people have even some rectal pain. You may or may not have difficulty to pee, meaning you're peeing more often or you have to push a little bit to pee. You often have painful ejaculation, or the pain is worsened by ejaculation. Some people have pain worsened or exacerbated when they drink spicy foods, or coffee, or caffeine, alcohol, acidic foods. So all these symptoms are sort of more generalized chronic pelvic pain. That's the difference.
Awesome.
Acute prostatitis, fever, chills, feeling sick. Chronic prostatitis, a low-grade infection, which can be treated with 6 weeks of antibiotics to really get in the crevices and penetrate the prostate and eradicate all those bacteria. And the other non-bacterial cases, which we have to look at a more global view of the pelvis, the muscles, the prostate, the nerves, and treat it from a multidisciplinary approach as well.